Hi everybody, it's Dr. Ansari. Today I'm going to be talking to you about overactive bladder, minimally invasive treatments. So we may come to this if you have a contraindication to medication or you've tried medication and it hasn't worked for you, then we move on, all right? Now, what's important to remember about minimally invasive therapies is that all of them are equally effective. 70% effective in reducing symptoms, 50% or more, okay? So that's really important to remember, is that all three of these are the same effectiveness. It's really what you can tolerate in terms of how it's delivered or side effects, or maybe you have a medical condition that makes certain ones not feasible for you. So these are the things that we're going to be talking about or already have talked about in the office or in the clinic, and created a plan. So if we've already talked about some specifics and you're not a candidate for certain procedures, just remember that this is general information. It doesn't negate anything we talked about in the office. This is just general information. So first we're going to talk about is PTNS. PTNS stands for percutaneous, means through the skin, tibial nerve, that's the name of the nerve, tibial nerve, stimulation. Okay, so we stimulate the tibial nerve through the skin. This is an office procedure, okay, and we may call it for short ankle stimulation or ankle stim, okay. It requires you to be in the office 30 minutes every week for 12 weeks. So it's a major time commitment, but there's very little downside to this procedure in terms of side effects, or if you have health problems that don't allow the other treatments, PTNS may be the better approach because there's no anesthesia involved in this. No operating room, it's just in the office. It's a pretty painless procedure that just requires 30 minutes weekly, but for 12 weeks. All right, so that's PTNS. The next option that you have is Botox Paralytic. This is literally the same Botox that people use to put into their wrinkles in their face, but we inject it through a camera and into the bladder. So it is done in the operating room, and it does require anesthesia. Okay, so so that is one of the downsides here. It lasts for 6 to 8 months and then has to be redone, all right? And it does have some potential side effects where you might need to self-catheterize if you have urine retention or cannot urinate, but that's in only 4 to 6% of people. So that means in 94 to 96% of patients, they don't have this problem. Sometimes it can cause a urinary tract infection, obviously, because we're doing a procedure through the bladder, so there's always a risk of introducing an infection that way as well. So Botox Paralytic is another option for some individuals. And then the last would be sacral nerve stimulation, okay? And now this is similar to the PTNS in that it stimulates the nerves, but this is a direct method of stimulating rather than this being indirect, okay? So this directly stimulates the nerves of the bladder. And this is it's an implant, like a bladder pacemaker, that goes into the back. What this will require is a test phase that's done in the office with some local anesthetic, meaning I inject the lidocaine under the skin to place the little wires that contain what are called leads. And then you test it out for 2-3 days, and if it works in reducing symptoms by half, 50% improvement, then we move on to the implant phase, where I put in the device into your body. It's under your skin, so there's nothing hanging out outside, and this is done in the operating room, okay? And it does require anesthesia, which is a twilight anesthesia, okay? So that's sacral nerve stimulation. Sacral nerve stimulation, the battery itself comes in two forms. One is a rechargeable device, okay? So the rechargeable battery is something that you'd have to recharge weekly for like 10 minutes, and then doesn't have to be replaced until about 10 to 15 years, okay? The second is a non-rechargeable, and because it's not rechargeable, then you replace it at 3 to 5 years, okay? It's replaced at 3 to 5 years. So you have two options in terms of batteries. But this is a good option for patients who really don't want to remember to do anything. It just does it for them. The first year is probably the one that requires the most adjustment, because it's adjusting to your body and the bladder is adjusting to it. So you might need some programmed setting changes, but we have device representatives that work very closely with us and help our patients through that whole process. And usually after a year, you're basically set with the program that you choose. But each one of these has a downside, and each one of these options has an upside, and it depends on what sounds more feasible to you, and again, what we talked about in the office, in case there is any reason that you are not a candidate for one or the other. So just talk to me about it if you want, if we haven't discussed this already, or if you want to consider any of these as options in the future. Thanks. Bye.